Hello and welcome to our channel. In this comprehensive video, we dive deep into challenging nursing questions related to basic life support BLS, tailored for both NCLEX and Prometric exams. Join us to enhance your knowledge and critical thinking skills as we provide detailed answers and thorough rationales to help you succeed in your nursing career. Whether you're a student preparing for exams or a healthcare professional seeking to strengthen your expertise, this video will be an invaluable resource. Let's start it. Question 1. A nurse is performing BLS on an adult who has collapsed. What is the correct compression to ventilation ratio for a single rescuer? A 30 compressions to 2 ventilations. B 15 compressions to 2 ventilations. C 30 compressions to 1 ventilation. D 5 compressions to 1 ventilation. Answer 1. A 30 compressions to 2 ventilations. Rationale. The correct compression to ventilation ratio for a single rescuer in adult BLS is 30 compressions to 2 ventilations. This ratio provides adequate chest compressions and ventilation to maintain oxygenation. Question 2. During BLS, a rescuer should place their hands on the sternum for chest compressions. Where is the correct hand placement for all chest compressions? A. Upper half of the sternum. B. Lower half of the sternum. C. Lower edge of the ribcage. D. Over the xiphoid process. Answer 2. B. Lower half of the sternum. Rationale. During adult chest compressions, the correct hand placement is on the lower half of the sternum. This allows for effective compression of the heart and optimal blood flow. Question 3. While performing BLS on a child, what is the recommended compression depth? A 1 inch 2.5 centimeters. B 1.5 inches 4 centimeters. C 2 inches 5 centimeters. D 2.5 inches 6 centimeters. Answer 3. B 1.5 inches 4 centimeters. Rationale. The recommended compression depth for a child during BLS is approximately 1.5 inches 4 centimeters. This depth is sufficient to generate effective chest compressions while minimizing the risk of injury. Question 4. During BLS, if a rescuer finds an unresponsive infant, what is the recommended compression to ventilation ratio for a single rescuer? A 30 compressions to 2 ventilations. B 15 compressions to 2 ventilations. C 30 compressions to 1 ventilation. D 5 compressions to 1 ventilation. Answer 4. A 30 compressions to 2 ventilations. Rationale. For a single rescuer performing BLS on an infant, the recommended compression to ventilation ratio is 30 compressions to 2 ventilations. This ratio is designed to maintain oxygenation and circulation in infants. Question 5. During BLS, if a victim has a foreign body airway obstruction choking and becomes unresponsive, what is the initial action? A. Begin chest compressions. B. Perform a finger sweep to remove the obstruction. C. Administer abdominal thrusts. D. Activate emergency medical services EMS. Answer 5. A. Begin chest compressions. Rationale. If a victim with a foreign body airway obstruction becomes unresponsive, the rescuer should begin chest compressions. Chest compressions may help dislodge the obstruction and provide circulation until advanced medical help arrives. Performing a finger sweep is not recommended in an unresponsive victim, and abdominal thrusts are used in conscious victims with a foreign body airway obstruction. Activating EMS is important but should follow the initiation of chest compressions. Question 6. During BLS, a rescuer finds an unresponsive adult victim after activating emergency medical services EMS. What is the next step? A. Begin chest compressions. B. Check for a pulse. C. Administer rescue breaths. D. Assess for responsiveness. Answer 6. D. Assess for responsiveness. Rationale. After activating EMS, the next step in BLS is to assess for responsiveness. This involves tapping the victim and shouting to determine if they are conscious and breathing. If unresponsive, chest compressions should be initiated. Question 7. A nurse is performing BLS on an adult victim. How deep should the chest compressions be? A 0.5 inches 1 centimeter. B 1 inch 2.5 centimeters. C 1.5 inches 4 centimeters, D 2 inches 5 centimeters. Answer 7. D 2 inches 5 centimeters. Rationale. The recommended depth for chest compressions in adult BLS is 2 inches 5 centimeters, adequate compressio, and depth is crucial to ensuring effective circulation. Question 8. During BLS, if a rescuer encounters a pregnant victim in the second or third trimester, where should the hands be placed for chest compressions? A. Upper half of the sternum. B. Lower half of the sternum. C. Above the level of the uterus. D. Below the level of the uterus. Answer 8. C. Above the level of the uterus. Rationale. For a pregnant victim in the second or third trimester, the hands should be placed above the level of the uterus to avoid compressing the uterus during chest compressions. Question 9. A nurse is providing BLS to a child victim. What is the recommended compression depth for pediatric chest compressions? A. 0.5 inches 1 centimeter. B. 1 inch 2.5 centimeters. C. 1.5 inches 4 centimeters. D. 2 inches 5 centimeters. Answer 9. C. 1.5 inches 4 centimeters. Rationale. The recommended compression depth for pediatric chest compressions is approximately 1.5 inches 4 centimeters. This depth is appropriate for effective circulation in children. Question 10. While performing BLS on a child, what is the correct compression to ventilation ratio for a single rescuer? A. 15 compressions to 2 ventilations. B. 30 compressions to 2 ventilations. C. 15 compressions to 1 ventilation. D. 30 compressions to 1 ventilation. Answer 10. A. 15 compressions to 2 ventilations. Rationale. The correct compression to ventilation ratio for a single rescuer in pediatric BLS is 15 compressions to 2 ventilations. This ratio ensures adequate chest compressions and ventilation in children. Question 11. A nurse is performing BLS on an infant. What is the recommended compression depth for infant chest compressions? A. 0.5 inches 1 centimeter. B. 1 inch 2.5 centimeters. C. 1.5 inches 4 centimeters. D. 2 inches 5 centimeters. Answer 11. A. 0.5 inches 1 centimeter. Rationale. The recommended compression depth for infant chest compressions is approximately 0.5 inches 1/900. Gentle and shallow compressions are appropriate for effective circulation in infants. Question 12. During BLS, if a rescuer encounters an unresponsive victim with a pulse but not breathing, what is the initial action? A. Begin chest compressions. B. Administer rescue breaths. C. Activate emergency medical services EMS. D. Check for a carotid pulse. Answer 12. B. Administer rescue breaths. Rationale. If a victim has a pulse but is not breathing, the initial action is to administer rescue breaths. This helps provide oxygenation and supports circulation. Activating EMS is important but should follow the initiation of rescue breaths. Question 13. A nurse is performing BLS on an adult victim. What is the recommended rate for chest compressions per minute? A. 60 to 80 compressions. B. 80 to 100 compressions. C. 100 to 120 compressions. D. 120 to 140 compressions. Answer 13. C. 100 to 120 compressions. Rationale. The recommended rate for chest compressions in adult BLS is 100 to 120 compressions per minute. This rate helps maintain effective circulation. Question 14. A rescuer is providing BLS to a victim, and a second rescuer arrives. What is the role of the second rescuer in a two-rescuer BLS scenario? A. Administer chest compressions. B. Provide rescue breaths. C. Activate emergency medical services EMS. D. Rotate with the first rescuer every 2 minutes. Answer 14. B. Provide rescue breaths. Rationale. In a two-rescuer BLS scenario, the second rescuer typically provides rescue breaths while the first rescuer continues chest compressions. This helps ensure continuous circulation and oxygenation. Question 15. A nurse is teaching a group of healthcare providers about the importance of high-quality CPR. What aspect of CPR is crucial for improving outcomes in victims of fast and shallow compressions? B. Deep and slow compressions. C. Interrupting compressions for ventilation. D. Minimizing interruptions in chest compressions. Answer 15. D. Minimizing interruptions in chest compressions. Rationale: minimizing interruptions in chest compressions is crucial for improving outcomes in victims. Continuous chest compressions help maintain blood flow and improve the chances of successful resuscitation.